Hello, my name is Gilbert Medina, and I'm here to provide you a guide on how to complete a Skinfold assessment to measure body composition. By accurately performing this assessment, this can provide an individual their risk for certain health conditions, such as cardiovascular disease, hypertension, diabetes, and forms of cancer, and many more. I just listed a few off the top of my head. As an exercise scientist, I will need to take measurements of the skin fold thickness at various sites around the body, which is done with a skin fold calipers. These measurements will provide the percentage of total body fat that lies directly beneath the surface of the skin. This will allow me to calculate the body's density with the regression equation and help me determine the individual's body composition. Now let's go through how to perform a skin fold test. Skin fold measurements are taken at specific sites on the right side of the body. I will begin by pinching the skin at specific locations and pull the fold of the skin away from the underlying muscles. So only the skin and the fat tissue are being held. The skin fold calipers are then used to measure the skin fold thickness in millimeters. I will take 2 measurements at each location and average these records. This will give me a better sense of each measurement at each location. So now, let's show you where to take these measurements from. Okay, so the sites that I would be measuring are the following 7 locations on the right side of the body. The tricep, which is behind your arm right here, your tris are at. You pinch it and pull it and then measure it with the skin fold capillars. The pectoral, the mid-chest just forward of the armpit, right here. The subscapular, the midline of the side of the torso. The abdomen, which is next to the belly button, right here. The suprailiac, just above the chest of the hip bone, right here. And then the quadriceps, the middle of the upper thigh, which is right here. So these are the 7 locations that I will be measuring for the skin fold assessment. Okay, so now we are going to go through the strengths and weaknesses of this assessment. Strengths. Skin fold measurements have been shown to be fairly accurate for leaner subjects with a standard estimate of error of 3.5%. 2. Limited and economical equipment is needed, and the assessment can be performed quickly once the trainer is proficient in the protocol in almost any environment. 3. Skin fold assessments can be a reliable method to look at progression of weight loss. Now to the weaknesses. Skin fold measurements are not an optimal or even appropriate choice for obese clients. Accuracy of the method decreases with increasing body fat as the measurement cannot measure visceral fat. 2, which leads into my second weakness. With obese clients, the psychological impact of pinching large amounts of fat can be very psychological detrimental to the individual. Consider how awkward a situation a trainer could find themselves if they were unable to open the calipers wide enough to assess a given skin fold. 3. Technician expertise is required for an accurate assessment, and research has shown that it takes adequate practice and repetition to even be reliable while implementing the test. Inaccurate skin fold location and inadequate pinch size are 2 main errors with this test. It is important to keep in mind that weight fluctuates constantly, and most body composition tests should be used as a general reference point and are best when averaged over a given time frame. Periodic measurement of the body composition can be useful in determining the effectiveness of nutritional and exercise training interventions for both athletic and non-athletic individuals. Okay, now the responsibility of an exercise science is to conduct a pre-test screening for health risk, either perform a physical examination or receive results of one, gather patient's history, and receive informed consent from the patient to perform the assessment. This concludes my guide for a Skinfold assessment for the measuring of body composition. Thank you.